Now, an Emeritus Newsbrief, I'm Lynn Huston. At first, there appeared to be a deal to close that $700 billion financial bailout. But later in the day, conservative Republicans rebelled. A visibly aggravated Republican Senator Richard Shelby defiantly said after the meeting with Bush at the White House that there was no deal and that he probably would not be invited back again. The unpopular parts of the economic bailout proposal? Well, the power given to Treasury Secretary Henry Paulson to determine the use of the $700 billion. White House demands that Congress cannot limit some aspects of payments to departing executives from failed companies. Democratic leaders don't want to hold a vote when the White House can't deliver a majority of the Republicans. In other developments on Capitol Hill, President Bush today signed the amended version of the Americans with Disabilities Act. The new ADA closes that loophole that allowed discrimination against disabled whose conditions were considered treatable. The loophole emerged from numerous court rulings. Also, the Veterans Mental Health and Other Improvements Act has passed both the House and Senate now, but differences are still to be resolved. The act expands mental health and substance abuse treatment and post-traumatic stress disorder research and provides temporary disability ratings, improved home loans, and housing assistance. A large group insurer claims that seniors are more likely not to take their meds during those insurance gaps. A study by Medco finds that Medicare beneficiaries on cholesterol medications are twice as likely to stop taking their meds when they reach their insurance coverage gaps. Much of the problem, according to the company, could be solved by seniors using more generic medications. The Center for Medicare Advocacy claims an October 1st deadline may bring discrimination against elderly who are ill. That's because after October 1st, hospitals will not be able to bill Medicare and Medicaid for treatment of conditions acquired at hospitals. Hospitals will be prevented from billing patients for that treatment. The group is concerned that hospitals may discriminate against patients in poor health who have higher risks of hospital-acquired conditions. The number of new unemployment claims is the highest it's been in 7 years. The Department of Labor reports that new unemployment claims ending the week of September 20th, 493,000 seasonally adjusted. The 4-week average of continuing claims, 3.9 million. Emeritus News, daily updates on issues and public policy you won't find anywhere else. That's an Emeritus News Brief. I'm Lynn Huston.